Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast. I'm Dan Carter here at Countryside Equine Hospital. Got Dr. Zoe Latimer with me here today. We're doing another little podcast. This one's a good one. We were trying to come up with what to do, and I realized we haven't done this one yet.
Yeah.
And I'm surprised, but this is I like to call this how to be a paramedic.
Yeah.
How to be a paramedic. So we're going to be talking about what to do in an emergency situation till your vet shows up.
Yep.
So
What to do and what not to do.
yes.
That's important.
Sometimes the not to do is important as what to do.
There's more on the not to do list.
Yes. I'd say the number one thing not to do in an emergency situation is use Google.
I was going to say panic.
Well, there's that, but I mean, you can panic all you want. Just as long as you're panicking, you're not doing anything. You're not doing any harm.
Stop touching things.
You just don't touch anything, and don't go on Google. Dr. Google is not your friend in an emergency.
Most of the time, that is a fact.
I know what you're thinking, like, oh, good thing there's ChatGPT. Still not your friend in an emergency.
Do listen to your vet. Do not listen to Google.
Google did not go to vet school. ChatGPT does not have a degree. So
yes.
So that's rule number one. So
yeah, we'll start by first defining what is constituted as an actual emergency. Like you need to call your vet right this minute.
Yep.
And we'll start there.
Yeah. I think about emergencies. I think about, of course, life and death.
Yep.
Life and death. I think about when a reasonable person would think, hey, I need to go to the emergency room.
Mm-hmm.
If something were to happen, if this same thing were going on with you, would you be like, hey, we should call an ambulance or we should probably go to the emergency room?
Yeah.
And that's what you want to think about. I guess that's the simplest way I know to put it. What is your definition, or what's your broad?
Yeah. I mean, when you translate it to the average person, that's probably the simplest way to put it in their terms. Like, if you were to put yourself in that horse's position, would you want to be seen by a doctor in that moment in time? If the answer is yes, you should probably call somebody.
Yep, call somebody.
Yeah.
Yeah, because...
Or if you see it and your initial reaction is, oh, you should probably call somebody.
That's a good one. And I'd like to say this is normal people call for something, because... I like to always say there's like hurt, and then there's like go to the emergency room, and then there's like the farmer shows up to the emergency room, right?
Yeah.
Farmer shows up to the emergency room, it has gone south. It is bad.
The arm is dangling by a thread.
Probably should have been there a long time ago.
Yeah.
So average thing, we show up to the emergency room. So I'd probably say the number one call we get is going to be colic.
Absolutely. Yeah.
So,
number one call. And a colic is, as most of you all know, if you've listened to the previous podcast, very general term. Colic is just means abdominal pain. So the really broad range of symptoms there, but yeah,
these horses are hurting. They're laying down, trying to roll, biting on their sides, not wanting to eat. Those things you're going to see. And it's, it's kind of funny because, if you've had horses long enough, you kind of look over and like they're laying down. You're like, oh, they're laying down comfortable. And then you can walk by and go, that ain't right.
It's a different kind of laying down. It's a depressed laying down. And, or they're standing in the corner with their head in the corner and, head kind of down, not in a exploratory way. Like it's different.
And this is when you want to call the vet.
Yeah.
Colic is definitely time to call the vet.
Yeah.
And this isn't the thing I like to say is on some of these, like colic, not a wait and see thing. If you notice this at 5 o'clock, don't wait till 10 to see if it gets better. Early intervention.
It will not get better.
Yes. Early intervention. That's where we want to be. Early intervention.
Yeah.
So what do you tell people to do if they, all right, step one, and this is what you want to think about. when I give talks about emergencies, one thing I like to tell people is you got to think about, like, horse owners, you need to think about yourself as the paramedics, right? Your job is to do no harm, stabilize, and either ship to a hospital or stabilize and have the vet on the way. This is not a time for you to play doctor. Okay. You're like a paramedic. So that's what you want to think about in these situations. We're like, you're the paramedic. I got to stabilize this thing. I got to keep it alive long enough until the vet can get there. That's your goal. So that's what we're going to talk about today. It's how do you keep things alive long enough for us to get there and solve this problem.
Right.
Just like a paramedic, they show up on scene. They ain't there to set the broken leg. Their job's to stabilize this thing, get you in the ambulance, and get you up to the hospital.
Yep.
And so that's kind of what we're talking about today. It's how to be a paramedic, I'd say.
Yeah, that's a very good way to put it.
Let's talk about what we need to do for a colic. What are people's idea? Like, what do you tell people? Like, hey, I think my horse is colicking. What's your do's?
Well, first things first. Well, horses always want to eat. Always want to eat. That's what they're made to do. They're made to eat. So if your horse is not eating in any way, shape, or form, you should be calling your vet anyway. So that's probably the first thing you want to do. Be calling your vet. Second thing you want to do is, usually I tell people to take away their food from them. So any like hay and grain for sure. If you have a, confined area to put them in, like get them out of the back 40, like up to a barn or somewhere. If it's at night, bring them up to somewhere where there's going to be light to be working on them. Can't tell you how many times I've worked on a colic out in the middle of a field where it's pitch black. We have no light. We're working by headlamps. It's so much easier if you have some source of light or water.
And start that process early, because if they're not doing good, your job, like, again, play paramedic, I got to get it to where you can get worked on. Start thinking like, all right, let me get this horse to the barn. Let me get it to light. And
depending on how severe the colic is. So like when you're on the phone with the vet, you want to first describe what's going on. The vet may ask you a couple questions. So some things you may want to, the vet may ask you, what's the horse's temperature? Sometimes, depending, how uncomfortable the horse is. So I kind of group them into like a mild, moderate, or severe colic. So if the horse is experiencing a very severe colic, the vet may ask you, do you have any Banamine on hand or something like that? And if like you can get the horse comfortable until I can get there, because it's going to be an hour before I can get there. If the horse is absolutely writhing in pain, can't stand it. But most of the time, if it is a mild or moderate colic, I will tell the client not to give them Banamine because I want to see them as is. But if the horse is in severe pain, I will tell them to.
Yeah, I do. I tell people to do all you can not to give that Banamine. And especially if you find them at 5, don't get Banamine and hope they get better.
Yeah, it doesn't usually work out.
Yeah, because the problem you run into is Banamine does not cure colic. It does not cure it. It is simply a pain medication. One of the things we're looking at when we examine these horses with the colic is how much pain they're in. So if we get there and you're like, Doc, he was terrible, and I get there and his heart rate, because we look at heart rate a lot, and his heart rate's like 36, I'm like, well, he's not in a lot of pain. It could have been 70, and you show up and he got 70. Well, now we hurt.
Yeah.
But if you gave Banamine, we get there an hour later, and it's like, oh, heart rate's 36. Like, this isn't bad. We may, and that's one of the biggest things to know how they're doing is how much pain they're in.
No, absolutely.
So I think it's
one thing you should not do is what I call it, walking your horse to death.
Oh yes.
I will get. In the past, I've gotten a lot of calls from people and saying, "Well, we've been walking him for the last 6 hours, and we've given him 3 doses of Banamine, and he's still not getting any better." And I'm like, "Okay, well, first off, please don't walk your horse for 6 hours straight. He's probably really exhausted and dehydrated now at this point."
Yeah.
Because what if you just went on a 6-hour walk? Wouldn't you be exhausted now? And then also, you should definitely not give your horse 3 doses of Banamine within a course of 6 hours. It should only be given once every 12 hours. So definitely way overdosing on Banamine.
Well, and I think the thing to look at too is the myth here about walking is they're going to lay down, roll, and they're going to twist their gut.
I get that one. They
Yeah.
ask me that all the time. Oh, why is he going to twist if, he's down? I'm like,
No.
they have disproven that.
Yeah, that's been disproven. Any kind of twist, like a torsion or a volvulus,
It was going to happen anyways.
displacement, that's what started this. It was already there.
Yeah.
They're not going to twist.
Yeah.
Okay. So once again, not going to twist. If they want to lay down and lay quietly, by all means, let them lay there.
I'll tell people that too. I'm like, if he wants to lay there and just hang out, that's fine. Until I get there, if he wants to just be quiet and lay down, let him just be.
Yes. I've had biliary colic, gallstones, and I drove myself to the hospital in the last one. Walking in there was miserable. And if you'd have told me, like, hey, you
got to walk for 4 hours.
You're going to walk for 4 hours? I've been like, put me down right now. Put me down right now.
Get the pink juice.
Yes, I'm done. So don't need to walk these guys. Your biggest thing with them laying down, even if they roll a little bit, you don't want them to hurt themselves when they're rolling.
Yeah.
Rolling into a stall, rolling into something sharp. So, make sure they're in a place where they can't hurt themselves. If they're laying there, laying quietly, go for it. Even if they're just rolling on occasion, that's fine. You do not need to lunge your horse. I have pulled up to emergencies, and they're out there with a lunge whip making this thing run around in circles, and this thing's pouring sweat. We probably got there because they're dehydrated to begin with.
Correct.
And now we have dehydrated them more.
90%.
Helping the situation.
90% of the colics I see are dehydrated.
Yes.
So, therefore, you're just making it worse.
Yes. So, myth number one.
Now you're definitely going to be paying for fluids.
Myth number one we're busting today. Don't walk colic.
You can walk a tiny bit.
Yeah, walk them
within reason.
Walk them to a good place to work with light.
Yeah.
And
just let them be.
And just let them hang out. And if they're rolling a lot, don't put them in a stall.
Yes.
Be outside the barn in like a grassy area where they've got room. If they're like up, down, they can get hurt in a stall.
Yeah.
If they're going to lay there quietly, let them lay there quietly in a stall. I'm good with that. So
just get them up close to the barn, or if you don't have an area like that, you can put them on like a long lead rope or a lunge line and just hang out with them. Just be with them. I mean, you're probably not going to go in the house and go to bed while the vet's on the way anyways.
Right.
So
you're there. You're hanging out.
Yeah. Also, please do not give Banamine in the muscle.
Yes. The bottle does say it's labeled for IM injection. Don't. Like it causes what's called a clostridial, or can cause a clostridial myositis.
Yeah.
And if you want to Google something, Google pictures of clostridial myositis, Banamine.
Or Banamine IM injection.
Yeah.
Gone bad. Google that.
It doesn't happen often, but when it does, it's bad.
I personally have never known a horse to survive one, but.
Had one.
Oh, one? Okay.
Had one.
Cool. Yeah. I've never known one to actually live, but
Yep.
It's pretty awful. Don't do that, please.
Yep.
If you do decide to give Banamine on your own free will against medical advice or whatever it may be, please just, for the love of everything, please don't give it IM.
Yeah, if you're not comfortable with IV, just give it orally.
Yep, you can give injectable Banamine orally.
It takes a whopping 15 minutes longer to work orally.
Yes.
It's great absorption, works fine. Again, Banamine is just an NSAID. It's no different than Advil for us. If you think about it, Advil orally, Banamine orally, both of them work. So yeah, colics, don't walk them to death. If they start to feel better, still don't let them eat. Okay, that's the other thing that we see is they find them colicky. They call the vet. We get there, they're outside grazing grass. And we're like, no, don't, because we got to pass the tube on this horse. And we got to get all that stuff back out of the stomach.
Oh, this reminds me.
Yeah, let's don't do that.
Also, please don't give them a bunch of stuff orally, like syringing it into their mouth, including mineral oil, milk of magnesia, Pepto-Bismol. What else have I seen people give them? Tums.
Yeah.
Just anything like that. Just
don't.
I'm about to empty his stomach out anyways. Just because that stuff can go in the lungs if you're sitting there fighting with your horse. So just don't.
Mineral oil in the lungs, I have yet to see one of those survive. They don't live.
Yeah.
And that's the thing is don't syringe mineral oil to them to a syringe orally. Don't do that.
I've seen that a lot. People are like, well, I've already given him like 6 syringes of mineral oil. I'm like,
Yeah, let's don't do
can
that.
you not?
Don't do that.
Please don't.
Yeah, when vets give it, one, it doesn't lube things up and cure colic. Like we found out through some research that it's not actually curing the colic as well.
That was disproven a long time ago.
Yes, it is simply a marker. So basically we can see the oil when they poop and know, oh, the oil made it through.
Because you can see the mineral oil on the actual pile of poop. So that way you know that poop has made it through the digestive tract. So
it doesn't lube anything up. It doesn't cure anything. So you're not helping by giving mineral oil. This is not helping. In fact, do we even have it here? I don't think I've used it in.
Well, no, we don't.
I don't think we do. I don't think I've used mineral oil.
We have scarlet oil.
Yeah. I don't think I've put mineral oil in the stomach in 12 years.
Another myth busted.
Yeah, I just don't use it. I don't have it. It doesn't help. And all I think about is
I'll still get people every now and then saying, are you not going to oil them, doc?
Well, I think about this too. Like your GI
They'll ask me
tract
that.
already doesn't feel good.
Yeah.
And then I'm going to dump a half gallon of oil in there. It'd be like if you're sick and your stomach don't feel good and they're like, here, drink this peanut oil. Yeah, that's the one.
Oh, yeah. Yeah. And some of them will deworm their horse as their horse is colicking as well. They'll give them dewormer because they think that they deworm them when the horse is colicking because they're thinking the horse is colicking because of parasites, which could be true. I've seen horses colic from if they have a huge parasite overload and some stuff is going on in the GI tract because if we got larval migration or something's happening or we have an impaction. But giving the dewormer after they're already colicking is like...
You're too late in the game because
that
dewormer doesn't just go on the GI tract and start killing parasites. Like this is a process. This is several days.
Right. You're a little late to the game. You missed the train. That train sailed about 2 weeks prior, so your heart is in the right place.
Right.
However, you're a little late to the game. And you need a vet at this point. You know, that tube of dewormer ain't going to save your life.
And again, your job in a colic is to present to the vet the best possible opportunity to help your horse.
Yes.
Again, be a paramedic.
Correct.
Best opportunity to help your horse.
Just get the vet there as fast as you can. How about that?
And we're on the way. We're coming. So, next one, choke. I think this is where things go off the rails when you go on Google.
There's so much bad information about a choke. Can I just describe probably all of the worst things you can do for a choke? Because I had one on Tuesday night that checked all the boxes of things you should not do on a choke.
Yeah.
Or would you like to describe a choke first?
Well, a choke is an esophageal obstruction.
Yeah.
All right. So it's where the esophagus has become blocked. The airway's fine. The airway's fine. The choke happens in the esophagus, not letting feed go down. And I think we've done an episode on this, but it's where
we did. Yeah, we did.
Yep. And so go listen to it, and it kind of goes more in depth into choke, but they can't swallow. And that's going to be a key player here. Or they can swallow, but nothing actually goes down. So stuff is coming back out.
The pipe is clogged.
Yes. So let's talk about I'm going to start off with what to do in a choke.
Yes.
Call your vet.
Yes. If a bunch of liquidy feed material, green slime and mucus is pouring out of your horse's nose and your horse looks like he's throwing up or like retching and hanging his head down to the ground or coughing a bunch, food is coming out of his nose, your horse is choking. Usually they're not wanting to eat or drink.
Yep.
Call your vet.
And the thing to remember is you want to keep this horse calm, because getting them to calm down, what cures a choke is we pass the tube and push the obstruction down.
I'll siphon out and kind of push at the same. I'll kind of alternate between. Yeah.
That's what solves the choke.
Yeah.
And you want to keep your horse as relaxed as possible, and then try to let them stay relaxed, calm, head down, remove any temptation to eat or drink from them, and you've got to relax. Your horse has got to relax. Everybody's got to relax. And just know the only thing that's going to fix this is we have to get there.
Mm-hmm.
So the secondary thing that happens with a choke, and this is probably the most important, the choke we can get cleared. But our biggest concern, this is going to get into our do's and don'ts, is secondary pneumonia from a choke.
Yeah.
And we covered that in that other podcast, is when they get secondary pneumonia because feed material is coming out of the esophagus, ends up going down the trachea.
Because when they're freaking out, they inhale some of the food.
Mm-hmm.
And while you're freaking out and trying to jog your horse around,
yeah,
they're breathing in some of that slimy food and it's going down into their lungs.
Mm-hmm. That's our worry. So let's get into, the only thing you can do here is you're going to have to wait for us to get there. You have to wait for the vet to get there or get your horse to the vet.
Yeah.
That's what you got to do. Again, think paramedic. So let's talk about what not to do.
So on Tuesday night, I get a call about a choke. It's been going on for 6 hours or so, which the sooner we can clear the choke, the better off you'll be because you have less risk of pneumonia because time is of the essence.
Yes.
The longer you're choked, the more that horse's risk of pneumonia goes up. So the quicker we clear it, you'll go right back to being normal, right?
Mm-hmm.
And then you have less risk of getting pneumonia secondarily. So 6 hours is quite a long time to be choked. That's 6 hours your horse is not eating, 6 hours your horse is not drinking, 6 hours your horse is stressed out, and 6 hours that your horse has the opportunity to get that food into his lungs. So waited way too long to call me.
Mm-hmm.
It's now 11 o'clock at night when I'm seeing your horse. And the guy tells me that he has been trying to stick a garden hose in the horse's mouth and flushing the choke out and basically drowning the horse with this hose. And then
And this is common. This is what a lot of people need to realize.
Yeah.
Like most people,
they'll put it in the nose or the mouth and basically waterboard the horses, and they'll put their head up and do it like that. And I'm like, there's so many things that I could say about that that's just wrong, all wrong.
And the crazy part, if you go on Google, it talks about this. It will say to do this, and
Please don't do that.
This is a big no-no. And granted,
you're drowning your horse.
We're going to come out. You're going to see us pass the tube. One, the horse is sedated, has his head down. All right, so gravity gets rid of it. Two, we're putting this tube into the esophagus
gently,
and that actually goes through the nose and into the esophagus, not through the mouth.
And the horse is voluntarily swallowing our tube.
Yes.
We're not forcing it, and we're not going into the lungs. We're not doing any of those things.
But when you grab the water hose, shove it in their mouth, and just start flushing, I mean, your risk of aspiration pneumonia just went through the ceiling.
And that's what I told him. I was like, you just really increase this horse's risk of getting pneumonia now because you basically just water blasted food all up into this horse's everything. Not to mention stressed the horse out probably because the horse thought it was drowning.
Right.
So please don't do that, no matter what you read or what somebody tells you to do. And then he also told me that he gave it 10 mils of injectable bute intramuscularly, which I don't know where he got injectable bute from, but it is injectable bute should never be given intramuscularly. It is very irritating to tissue. It needs to only be given IV. So please don't do that.
And not the medication of choice for a choke.
It should be Banamine, not bute, but regardless, you never want to give injectable bute in the muscle. I was like, please don't do that either. And then he also gave it six mils of penicillin IM. So at least he did give it IM, but 6 mils for a Frisian is way too small of a dose anyways.
Yeah, so you're pushing close to like 20 or 30 on a Frisian.
6 mils is like for a calf. So
yeah.
So I was like, don't do that either. All right. So
your biggest thing is keep them calm.
Yes.
Keep the head down. Wait for the vet to get there.
Yeah.
There's not a whole lot else you can do. And then the other one, like I hear a lot, is people try to push mineral oil again through a syringe.
Not going to help.
your risk of aspiration. And like I said, mineral oil in the lungs, they don't live through this.
Well, and the mineral oil is not going to go anywhere because
Can't.
it can't go to the stomach because you have a choke. So
Yes.
it's not going to help you in this situation.
Yep.
And something that is not going to hurt, you can, on the left side of the neck, you can massage with your fist, like not forcefully by any means, but you can go from the like back of the jaw down to the chest, like following along the jugular vein and like where the esophagus runs. You can kind of take your fist from the jaw, work your way down to the chest while the horse is relaxing. You can do that while you're waiting on the vet. So that's not going to hurt anything. It will just maybe try to help massage it. So.
Yep. So those are your big things.
Yeah.
So that's colic, that's choke. Let's talk about the other one we get a lot is lacerations.
Yes.
Cuts.
Lots of lacerations.
Yes. Blood always looks
Love
like
a good
more than what it
laceration.
is. And I always like to say, let's put things into perspective. Because most people are always worried my horse is going to bleed to death. I haven't seen it yet. Your horse, if it's a 1,000-pound horse, has about 80 liters of blood.
Which is incredible when you think about it.
Yeah, the way I visualize it is you think about a 2-liter bottle of Coke. On average, there's 40 of those inside your horse at any given time. It's got to lose 15 of those before we even detect a decrease or drop in the PCV. Got to lose a third. That's a lot of blood. And blood always looks like more than what it actually is.
Yeah.
So horse, if it's a limb laceration, other than like a femoral artery, probably not going to bleed to death. So femoral arteries, which is on the inside of the back leg, lacerations neck like jugular carotids, those that can bleed to death.
Yeah.
But luckily, those don't happen very often. So I'm probably not going to bleed to death. I always say, like, what you don't do here is as important as what you do. First thing is, like, get it clean, get it covered.
Yeah.
Get it clean, get it covered.
And get the horse calm, because lowering blood pressure will decrease. Because usually when they sustain a laceration, hopefully you find the horse pretty quickly after it occurs. If it is a big bleeder, like if it is a pretty significant laceration, hopefully you find it pretty quickly. Otherwise, what we're talking about may not matter. But hopefully you're there and you can, like, administer first aid pretty quickly. But yeah,
Lavage is the key. If you want to know what to put on the wound, water.
Yeah.
Flush it.
Yeah.
Okay, and a water hose works just fine. Getting that wound irrigated, flushing debris out of it, those are all good things. Start cleaning that leg up. Soap and water's your friend.
And you can wrap it pretty tight as long as the vet is on the way. You don't want to leave a tight wrap on for 2 hours,
And seldom, if ever, do you actually need a tourniquet.
I have asked, I think, a total of 2 people to put a tourniquet on because I had them send me pictures and videos of the wound, and it was like pretty high up on a hind limb, or it was like pretty scary. So I was like, put a tourniquet on and wrap over the wound, directly over the wound, like pretty tightly. And I was like already en route. So yeah. But most of the time, if it is like a pretty distal limb, like basically from the knees and hocks down, you can wrap directly over the wound pretty tightly. So not necessarily a tourniquet, but just like a pretty
firm bandage,
firm pressure. Yeah. And then get the horse calm, because lowering in the blood pressure is gonna not let them bleed out more quickly.
So things to put on there, nothing.
And no lotions and potions, no powders and all those good things, creams and whatever you want to resist the urge.
No purple spray.
Oh my God.
No purple spray.
Yeah.
I don't know what the purple spray is good for, because I haven't found a use for it.
Or the wound dust. Wonder dust.
Just so y'all know, Wonder Dust is for proud flesh. If you have proud flesh, that's what it's for. It's a caustic powder for proud flesh.
Yeah.
That's not going to happen on a wound until you're like 7 to 10 days in at the earliest. Really, it's going to be closer to 2 weeks before you get a proud flesh land. So wonder dust does not need to go on the wound.
Mm-hmm.
Soap and water, just like your grandma talked about. Like we get there, we're cleaning with soap and water. Very seldom am I grabbing betadine.
Yeah.
I'm hardly ever grabbing chlorhexidine. They're great disinfectants.
Mm-hmm.
But at the same time, this wound's, most lacerations, we're there within a couple hours.
Mm-hmm.
You don't have enough bacterial growth to matter.
Mm-hmm.
Like it's not quote unquote infected.
If I have a stinky wound, that's different.
Yeah, if I've got one that's been there for days, that's a different situation. But a fresh one, because what happens?
Good old garden hose.
Yeah, betadine and chlorhexidine actually keep them from healing.
Mm-hmm.
It actually kills good cells too. So don't need to splash any of that on there. You get it clean, like your grandma talked about. Soap and water. Don't need peroxide. Don't need alcohol.
Yep.
Just soap
yeah,
and
no
water.
alcohol, no hydrogen peroxide.
Yeah.
Some people are like, well, I've been cleaning it every day with peroxide. I'm like, don't.
Yeah, peroxide we have found does not help healing.
It kills everything.
Everything, good cells, bad cells, kills it all.
So it's slowing your healing process.
Yep.
So are all your lotions and potion.
Yep. So clean it well, get the mud off. Light. This is another time I'll say, let's get prepared for the vet to get there. So
good lighting.
Good light.
Yes.
Most of us, you're not there yet, but when you start to get over the age of 40, there's simply not enough light in the world. You need more light.
Dan wants surgical lighting.
Everywhere. Like,
go get your shop lights.
Yeah, it's going to happen.
Yeah.
When you, like I said, 45 was rough because now there is not enough light for sure. So
yeah, you gotta get all your best flashlights and your shop lights and your.
I've got amazing headlight. Everybody picks on about my headlight because it's a very bright headlight, but I have found I got over 40 and I was like, I need some serious light.
You can't see.
Camping store headlight not working anymore. I got to have the mega light. So
yes.
So lacerations, get them clean, get them wrapped, stop the bleeding. You're gonna be fine. We'll get there and we're good to go.
Yeah.
So here's another one that did occur this week that I think we need to talk about. We actually did a Facebook post on this last week or this week. We did the nail in the foot. Yep. I don't know what it is about horses, but if you need to find nails in your pasture, if you put a horse out there, they will find it.
They have magnets on the bottom of their feet.
Yes. If there is a nail somewhere in your pasture, if you put a horse out there, they will figure out how to step on it.
They're actually born with them in there.
I think so, because they will find them, and I don't know how. So they find this.
I hope y'all know I'm kidding.
Yeah. So the biggest thing not to do is take the nail out.
Resist the urge. I know it sounds crazy when the vet asks you, please do not pull the nail out, because you're like, what? This nail is sticking in my horse's foot. You want me to just wait on you to get here while my horse is suffering?
Yes.
And I'm kind of like, yes, I'm sorry, but I need to know. I need an x-ray of exactly where that nail went.
Yeah, because
it is critical.
Yeah, because it's location is everything.
Location.
It's like real estate. Like, because, did it hit the coffin bone? Did it hit the deep flexor tendon?
We will have no idea.
Did it go into the navicular bursa? The only way we know this is to get that x-ray with the nail still in the foot. So,
or did it only go in this far? We will have no idea.
Right.
Yeah.
And it's one of those things that a quarter inch matters. A quarter inch and we're safe. A quarter inch and we may be in the bursa. It's a game of quarters right here. It's important.
Yes.
So wait for us to get it. Like, somebody asked me, like, what do I do? And I was like, this is the one time I may tell you to just put your horse in cross ties, walk away and start panicking. But remember to walk away first. Because if you're walking away, you're panicking, you're boiling water, whatever, you're not going to pull that nail out.
Yeah.
All right. And then we'll get there.
Go clean your saddle or something.
Yeah. And I know it seems like what we're saying is bad, but if we know, because if we hit a bursa, this is a horse that's got to come in the hospital. We got to do surgery on it.
Yes, immediately.
And that's a surgery today, not 3 days from now.
Yeah. Yeah. So, a difference of 3 days is possibly a difference between life and death. So,
yes. So
it's important. It really is. And getting the x-ray while the metal is still in the foot, and it may not be a nail, it may be a piece of metal, or maybe a big piece of wood. I had a horse with a piece of wood and a big chunk of wood in the foot as well. So just leave it, because knowing exactly with an x-ray where that went, what all it touched. It's extremely important. It could mean the difference between life and death for your horse. So
it definitely could.
Yeah.
You know, the hard part comes in if we got to transport them. We get people to call us and they're from out of town.
Yeah, that's
and this
hard.
is a lot of times, you know, if they can't bear weight on, it's going to be a long trailer ride.
I will tell them to basically take a couple of diapers, pad the foot, wrap it super, super good. So there's at least basically make like a nub at the bottom of the foot.
Called a Q-tip. That's what I call it. It looks like a giant Q-tip down there.
I'm like, that's the best we got. Come on.
Yeah. And there was one, it was coming from 4 hours away, and I hated everything about this. But I remember I told him, I said, I need you to pull the nail. This is the one time I actually told him to pull the nail. I said, but I need you to mark on the nail where it went into. Because what you run into is when you pull that nail out, that hole will start closing. So a lot of times I can't get contrast in there. I can't get a probe through there. But at least if I have the nail marked, and again, this is, you're putting them on the trailer and you're coming from a long way away, and this is, your vet told you to do this.
Yeah.
That's the only time you pull the nails, the vet says to pull it. I'll have them mark the nail. And so at least I can somewhat guesstimate, did we hit a bursa or not?
You can make it a more educated guess.
Right.
Yeah. Rather than just, well, we have no idea.
Right. So, bottom line.
Oh, yeah. And then also, so if a nail or an object goes into your horse's foot, that is a vet call first, not call your farrier.
Yes.
The farrier is probably just going to tell you to call the vet.
Yes.
If it's deep enough, probably.
And I can tell you, you know, so I was a farrier for 10 years before I was a vet.
Yeah.
And I can remember getting that call.
And like the farrier is probably just going to say, thanks for calling me, but you should probably call the vet.
Yeah.
That's usually what.
We'll put the treatment plate on after surgery.
Yeah. Yeah.
That's kind of about it.
So you could just save yourself a phone call. Just call the vet first.
Call the vet.
Yeah.
Don't pull it out.
Because the farrier is going to say, well, I don't have an x-ray.
Yep. And once you call the vet, just keep the horse still. And you can go panic and have a breakdown. I mean, because we're going to tell you, I always love doing this. Like, I tell people on the phone, it's like, hey, first thing is I don't want you to panic. And I feel like I get it. If my horse stepped on a nail and I wasn't a vet, I'd probably panic too.
But if you tell me not to panic, I'm probably going to panic.
Exactly. So you're going to panic.
Yeah.
But that's fine. Just don't panic and pull the nail.
Yeah.
You can go quietly somewhere and panic. It's okay. So stepping on nails. This is another one we get. Snake bites.
Yes.
Luckily, we don't see a ton of those.
Thank goodness.
We are down here in Georgia.
But the ones we do get are pretty nasty.
Yep.
Yeah.
In Georgia, we have, there's 4 poisonous snakes in the U.S., and we have all 4 of them. Probably 5. We probably have something down here that I don't even know exists. Like, that's the thing about Georgia.
We probably have a mamba I don't even know about.
Yeah, I mean, if it bites or stings, we have it down here. So, and it seems to be mostly springtime when I see these. That's when snakes are out migrating around. They're reproducing, they're breeding.
I saw a copperhead last week.
Yep.
Yeah. Coming across my driveway, and I was like, okay.
Up here, copperheads are the big thing. Where I'm from, we had the water moccasins and the rattlesnakes.
Wow, yeah, we have timber rattlers a lot around here, and then copperheads mostly. And then, I mean, we definitely do have water moccasins here too. So.
Yeah. And I get it. I'm somewhat terrified of a snake. I'm not even going to lie.
Oh, I'm absolutely terrified.
I grew up in the land of water moccasins, old cottonmouths, and they're nasty.
I can identify a snake, but I don't want to touch it.
I mean, I'm going to run. I'll probably never figure out what it is. I ain't going to lie. Like, I'm running looking for a gun. That's just me. I'm panicking. I'm freaking out here, okay? It's like, you like, all right, Dan, I got a snake over here and I got a grizzly bear. I'm like, well, how big's a grizzly bear?
Yeah.
You know, that's the way my mind works. It's irrational, and I own it.
Yeah.
But
if your horse gets bitten by a non-venomous snake, it's probably going to be just fine.
Right.
Nothing's going to happen. We're talking about a venomous snake bite. So.
And I don't know, and most of the time this is going to be on the muzzle. It's going to be on the face because normally.
Or a distal limb.
Right.
Yeah, I've seen that too.
But usually, the horses are kind of down grazing, eating. They stumble upon it.
Yeah, it's usually on their face somewhere.
Boom, they're going to get bit. Yeah. Just be prepared. They are going to swell.
Pretty quickly.
Quickly and a lot. It's going to be a lot.
Yep.
Worst case, again, this is also called the vet. Time is of the essence because we don't need them to stop breathing.
Mm-hmm. Worst thing that happens, well, usually the first thing that happens is their head literally starts blowing up like one of those balloon animals very, very quickly. Yeah. And then worst thing that can happen is their airways will start to swell shut.
Right.
So that is why you need to call your vet immediately.
Yep. We keep tracheostomies on all the trucks, and that's the main reason we do the snake bites, where the nasal passages will swell and we have to get them where they can breathe. But call the vet. We're on the way.
Yep.
And really, unfortunately, there's not a lot we can do here other than your goal here is to move the horse away from the snake, because I'm going to want really short grass. I'm going to want concrete, because you tell me your horse got bit by a snake. Now I know there's a snake at your house. Now I'm getting out of the truck about half terrified. So
Dan says, bring it in the house.
Yeah, I need you to bring this thing in the house. Again, it's my irrational fear.
That's really why he wants you to bring it to the clinic.
Yeah, because as far as I'm concerned, this clinic is snake-free, and I'm going to pretend like that's the case. We don't even have them outside. So
I won't tell you I saw a snake in the barn.
Yeah, let's don't talk about that. Let's don't talk. So, but yeah, get the horse away from the snake. Wait for us to get there.
Yeah.
We got it. Because really the snake bite, like once they're breathing, unfortunately, it's a week or two before we actually know the severity of this damage. So you kind of have, there's kind of 2-stage emergency here. One, we need to get the initial, your horse is stable, breathing, life's good. It's usually not the snake bite that actually kills the horse. It's a secondary infection that causes the problem, because some of these snakes, their bites are pretty venomous, and it's a hemotoxin, so it actually causes a lot of necrosis of the tissue.
Get a lot of tissue death, and also so a couple of the ones that I have dealt with, they get say for example they get bit on the muzzle, which is a super common spot. They cannot move their lip.
Right.
And so it's also very painful because they're so swollen. So even just the slightest touch is really painful to them, and it's really big and purple and nasty, and they're not getting a lot of blood flow there.
Yeah.
So it's really hard for them to eat. And they're slobbering a lot. You know, they're not swallowing really good. So what Dan is talking about is the secondary effects, meaning they're at risk of colicking and dehydrating because they're not eating and drinking like they should be, because they're not comfortable. It's literally just painful, and you have to ride it out. TLC, you know, and
supportive care,
and, you know, having that close relationship with your vet every step of the way until you can I have managed to save all the ones that I have had, but I have had, we have had, Countryside has had a couple that did not make it, but it's, it depends on the location of where they get bitten, I would say.
Right.
So
everything's about location there too. The muzzles, they're typically going to make it. We just need supportive care.
Yeah.
And like I said, a lot of times your vet may want to, like, they may get it stabilized and they're going to want to ship it to a hospital somewhere. Go ahead.
They may need to go on IV fluids.
Right.
Because they can't drink, or and there's conflicting evidence about steroids or no steroids, because steroids are great for anti-inflammatories versus do they delay healing? So, yeah.
I'm still a steroid guy.
Yeah.
I'm a steroid guy.
I am too. This is the cases that I've had, I've put them on steroids because that was the only thing that would make the horse start eating again.
Right.
Because of the pain. The pain was so
the pain and
bad.
swelling is real.
Yeah.
So.
Yeah, I think steroids literally save their life. So.
Next one is respiratory distress.
Kind of goes along with snake bites. I mean, yeah. So respiratory distress could be from allergic reactions. You know,
acute asthma flares. I've had horses with known equine asthma.
Yeah.
And some dusty hay comes in, it triggers this, and these horses are struggling.
They sound like they're trying to breathe through a straw.
Yes.
Yeah.
So call your vet. They may give you some instructions as far as triage so they get there. If you've got one of these horses, you probably already have some things on hand.
You may have already previously, like if your horse has been diagnosed with asthma or severe allergies, you may have already discussed with your vet maybe to have some emergency drugs on hand, like
Right.
Dex.
Yeah, that's
We
usually
don't just hand Dex out to most people, but if you have a horse that has it severely, you may have a little emergency kit with some Dex in it because of this exact instance.
dexamethasone being a steroid, and I always say this is kind of like your EpiPen, right?
Yeah,
Like
exactly.
if you got severe allergies, you're carrying that EpiPen everywhere you go. If your horse has severe asthma, your Dex is kind of like their EpiPen. It goes everywhere you go.
Yeah.
But you're going to make that phone call first and be like, hey,
I've got my Dex.
Yeah, let's go ahead and give X amount. I'm on the way.
Yeah.
But we need to go ahead and give that.
Mm-hmm.
So, and early.
Oh, yeah.
Call us early.
Yeah.
All right. Because you don't want to say, oh, I've been here before. Let me just give this Dex and it'll be fine.
Yeah.
We have other medications sometimes we have to give to get these horses calmed down. The other thing is remove them from dust. This is what I say. If this is happening in the barn, take them outside the barn.
Get some fresh air.
Yeah. Give the Dex, but remove them from where they might.
Also, don't be walking them around.
No, just let them chill.
They can't breathe.
And it's going to feel like an eternity till we get there. Because I've been there. It feels like an eternity waiting on the vet to get there.
It does.
Stay calm. Again, be a paramedic. Stay calm. So, that's going to wrap up. I guess the other one I want to talk about is eyeballs. Eyeballs.
Yeah.
This is not a wait and see situation.
There's not a whole lot that an owner can do for an eyeball that is going to be helpful.
Mm-hmm.
So yeah, most eyeballs from anything from small, medium, and large, just call your vet, because even the smallest eyeball situation can super, super quickly turn into something that may cause the horse to lose its eyeball.
Yep. Corneal abrasion, so scrapes, scratches to the corneum. Those can go downhill really quick in a horse.
Oh, yeah.
Like it's, 24 hours, you can go from having a small scratch, and then 24 hours can be like, oh no, we may not save this eye.
Yeah.
It can happen that fast. So again, pick up the phone, call your vet. This is when we may triage a little bit. This isn't a respiratory distress, a colic, or a choke. We're going to shift things around and get there right away, but we're going to be there.
Yeah.
We're going to be there that day, but definitely want to get those looked at because there's a lot of different things that can affect that eye, and we need to figure out which one it is. So again, you've got an eye, and what you'll see on these, they're kind of squinting a lot, holding their eye shut, don't want to open it. You may see some cloudiness.
Some runny eye, really red tissue. Yeah.
So yeah, that's when you'll pick up the phone, call your vet. We'll kind of triage that one a little bit over the phone. We're not lights and sirens like we are with some of these others. I do wish we could get lights and sirens for our trucks. I think they need to put in. I think we should be able to get lights and sirens like an ambulance.
How cool would that be? And we have like a deal with the police, where they just they see us and they know.
I will say that is one thing. I have been pulled over once rushing to get to an emergency. It was a respiratory distress case, and I was going a little faster than I probably should have. And I remember he was great because he's like, man, what's the hurry? I was like, look, I got a horse in respiratory distress. I'm just trying to get there.
Yeah.
And he's like, oh, well, go.
Yeah.
I mean, he didn't even check my license. He just sent me on the way.
That's nice. That's good.
Because around here, everybody, like you say, you work for Countryside. I mean, most of the in this area, most of the police officers, everybody kind of knows who we are. We've been here for almost 40 years. So, I mean, we say that, and luckily they're like, all right, you just go. I get it. My wife's got a horse. I would want you to do the same. So they're usually pretty good, but I do wish we got lights and sirens.
That would be so cool.
But yeah, like colics, chokes, stepped on nails, snake bites, respiratory distress. We're kind of lights and sirens on that one.
Broken legs.
Broken legs,
there's not a lot you can do. I'm really sorry. Just keep the horse calm.
Yep, we're on the way.
Yeah.
But eyes, we'll triage that one a little bit. We're going to be there that day, though.
Yeah.
So I think that kind of sums up the bulk of the emergencies
I can think of off the top of my head.
Yeah, you don't, like, I always tell people, new vets that come out, there was like, oh, I'm really worried about emergency. I'm like, well, there's only like 7 things you're ever going to see. There's like 7 things you're going to see on emergency. It's the same 7 things.
And you need like 7 drugs.
Yes. and it's
They'll treat all of them.
Yeah. It's funny because after about a year running some emergencies, you're like, oh, there's really only 7 things you're going to see on an emergency.
God, now that I think about it, you're right.
Yeah.
Huh. Yeah.
There's 7 things to see in an emergency, and that's about it.
That's why I've like never thought about it like that. But yeah, you're right.
Yeah, that's it.
Yeah.
So, but yeah, if y'all can do those things, and I'll tell you, remain calm. I know we joke about it, but
Yeah.
stay calm. You're going to have a brief freak out, and that's okay. It's okay. Call us. Call your vet.
If it helps you, call a friend and have your friend come and wait with you.
Yeah.
If that keeps you calm, whatever you got to do.
Yeah.
Go get your cat, hug your cat.
Yeah. I mean, we get it. We're on the way. And that's the big thing we try to tell is like, we're on the way, but we've still got to drive.
Yeah.
So.
Yeah, we can't just teleport there. That would be cool though.
We kind of would actually.
Yeah. Maybe one day.
One day. So. All right. Well, thank y'all for tuning in today. Hope this gives y'all some great tips and tricks for what to do on emergencies. If you got any questions, when in doubt, call your vet. Thank y'all for tuning in. Dr. Zoe, thanks for being here today. Thank y'all for listening, and we'll catch y'all next week. Thanks. Bye.